So TIA is a transient ischemic attack, and that is where there is a temporary blockage of one of the arteries, one of the blood vessels, to a part of the brain. When that happens, that part of the brain is not working properly, and so the person will have symptoms technically of a stroke. But if the body is able to open up that blood vessel itself quickly enough, the symptoms will go away and there will not be permanent damage. That is a transient ischemic attack, or a TIA. So we know that people with TIA or minor stroke would typically be admitted to hospital and stay in hospital for 3 to 5 days. We developed the TIA and minor stroke rapid assessment unit, or the TAMS unit, which is a day unit that, with partnering with radiology, cardiology, patient education, nursing, and allied health, we devised a system so that we could get that inpatient care session done in a period of, say, 3 to 6 hours. The TAMS unit that was developed really has provided us with another level of care where we identify people at highest risk of having a stroke, where there's the most to lose because they've had just a TIA and they've returned back to normal. Those high-risk situations then would be treated, and that will help to prevent stroke. We know that the experience in the past, typically when people are seen in the emergency department, it's really not set up for taking the time to do an entire education session for people regarding the warning symptoms of stroke, the risk factors, and what they can do. So now that we have them more as a captive audience for a few hours in between the different investigations or tests that we'll be doing, that is where the role of nurse practitioners, as well as our allied health team, are to really assess the person for some of these risk factors and to provide them with the education so that they can help prevent future stroke for themselves. So a large part of what we do in the TAMS unit is to provide that education up front for people.
It's a comfortable environment. Things are close by. They have their own lockers, there's a bathroom, and it's visually pleasing. So I think, they really feel like they're not in a room or a hospital, but more of a setting where it's, they can be themselves and we can talk about stroke. If they do have a stroke and they do need some extra attention from some of our allied health, physiotherapy, occupational therapy, or speech, or social work, we are able to access our allied health team to come in the same day and provide services or suggestions for them going home. And there's always that sort of, at the end of the day, they leave and we provide them with all of their appointments and their contact information, so they really feel comfortable at knowing what the next step is when they're leaving here. So I think that really makes them comfortable. They've come from a sort of a place of unknown, rushing into the emerge, to a place the next day where they're getting very individual care. And I think by the end of the day, they really appreciate and feel better about what's happened.